Hello, my name is Edgar Segovia, and I am currently a senior here at New Mexico State University. And my major is family and child science, and I have a minor in child maltreatment, which brings me today to speak about the treatment for child abuse victims. We're going to talk about the effects, long term, short term, everything up until getting the treatment. And hopefully, we're able to nail everything in this presentation to give you a better understanding of what goes down in the treatment of the child abuse uh, victims and how they're being taken care of and how they are sent on a road of recovery. To begin, we're just going to go over some child abuse statistics. At least 1 in 4 children have experienced neglect or abuse at some point in their lives. 1 in 7 children experience abuse or neglect in the last year. An estimated 702,000 children were confirmed by Child Protective Services as being victims of abuse and neglect in 2014. Just to look at this, child abuse is a very prevalent issue in our society today, and it needs to be confronted and it needs to be assessed. And by the looks of it, we're working on it, but there's still room for improvement. And we're going to talk about the impact of child abuse. Sexual abuse and its impact should be seen along a continuum ranging from neutral to very negative. Since children are unable to fully understand or exhibit the impact of abuse, professionals usually rely on the development of behaviors to signal emotional difficulties. Uh, it's hard to pick up on what's going on with the child and what exactly they're experiencing, but whenever certain things raise red flags, then the ability to be able to assess that problem is presented, and we are able to help the individual progress into a road of recovery. And we're just going to go over the short term problems that come with the effects of abuse. We have anger and acting out, difficulty regulating emotional responses, fear and anxiety, interpersonal problems, school difficulties, post traumatic stress disorder, sexualized behaviors, and sleep problems. And these are all issues that could turn into long term problems. But if the issue is handled from the beginning and the source of it, we should be able to see an increase. Uh, I'm sorry, a decrease in these problems and to actually see growth in the victim. And moving forward to long term problems, we have anxiety disorders, depression, PTSD, sexual dysfunctions, substance related disorders, and suicidal thoughts and behaviors. So, even with the short term factors being able to be faded away, uh, the long term problems actually are pretty dangerous and they are very prevalent in the lifestyle that these individuals carry out. uh, the road to recovery can be very tough, and these children can have issues that follow them all the way into adulthood. And in reality, we want these individuals to grow and prosper, and sometimes it's very hard for them to escape these negative consequences as a result of their abuse. It's not their fault. They went through some trauma, and the trauma wasn't dealt with correctly, and as a result, they suffer from these issues that will follow them for the rest of their lives. Next, we'll go ahead and go into the definition of treatment, which is medical care given to a patient for an illness or injury, a session of medical care, or the administration of a dose of medicine. Helping an abused or neglected child that discloses. The first step is to avoid denial and stay calm. Don't interrogate. Reassure the child that they did nothing wrong. The safety of the child comes first. Looking at all of this, we see that the child is confronted with something that they are unwillingly not understanding of, and they find it hard to conceptualize what happened in their mind. Our job is to help this child process the issue of the trauma without making them feel like they're the ones that did something wrong. They need to be let known that they are a victim and what happened to them isn't supposed to happen, and that they need to be okay with the fact that it is not their fault. Because in instances, we have children that have guilt and they feel like what happened was their fault. Our job is to reassure the child that they did nothing wrong. Um, it's imperative to let them know this. The self esteem of these children relies on this teaching of helping them feel comfortable with what they are saying and what they are disclosing, and to really allow them to be able to open up about what they want to speak about. Providing the perfect environment for them to be able to disclose is essential at this point in time. Also, we need to go into the talk about reporting child abuse. If you suspect a child is experiencing abuse, speak up. This is a preventative measure to avoid further trauma on the child. Uh, if there's the slightest hint that the child might be experiencing abuse, it is your duty to report it. It is your duty to let this be known to local law enforcement. We do not want the child to go through more trauma than they already have. Uh, Possibly even be confronted with death in their course of abuse. Uh, Prevention is key at this point in time. If we knowingly know something is going on, then we need to report, and this needs to be addressed, and this needs to be something that is apprehended and controlled at that point in time. It is all in the best interest of the child and how they will develop as they grow. The parental response and support and distress have proven to influence children outcomes. Parents need to be that supportive structure for the victims, and it really helps the victims with their ability to recover. When they have a supportive person there behind them, giving them their support, their motivation, uh, it just does wonders for their self esteem. It gives them the motivation to move forward. It lets them know that they have everything in their hands to look forward and to look forward to a positive future that will be able to enlighten their path. In order to optimally support a child's recovery from sexual abuse, the parent needs to be able to provide support for the victim. There's no other way around it. If we have a situation where the parent is picking sides, maybe the stepdad sexually abused the child, and the mother chooses to believe the husband, not the child. This is a very serious issue that can very much cause harm to the child. Parents need to understand that they need to support their child. Their child has nothing to gain from this situation, and they are just hindering their ability to grow up and to be able to develop into positive human beings. Sadly, sometimes that isn't the case, and issues like this destroy anything, any form of support that the child might have. But it is our job to help them overcome the trauma and to move forward and to understand that everything that is happening is not their fault, and that they need to move forward, and that they need to become the best possible person that they can be with or without their parents. But in essence, having their parents there for them is key, and the parents' contributions and support will really help influence positive outcomes and really support the development of the self esteem of the child to be able to move forward from this negative situation. Here we are talking about types of physical abuse. We have head injuries, and can be from baby shaking, abdominal injuries, punching to the abdominal, kicking, throat injuries, maybe choking, thoracic injuries, chest injuries of any sort, skeletal injuries, broken bones, fractures, skin injuries, bites, burns, anything. Any type of physical abuse that is inflicted on a child is going to cause trauma, and it's going to cause pain, and it will cause a reminder of what happened. Then we go on to evaluations of physical abuse. Where was the child injured? Likely biases and motives of the witness. Physical examination of the child. Possibility of injuries being accidental. Investigation. Use of selected laboratory and imaging modalities. and development status of the child. Child medical history. Has the caretaker reported changes over time, inconsistencies? Do different caretakers tell different stories when interviewed separately? All of this is key when analyzing the continuum of physical abuse. We need to know the source and if there's any inconsistencies all around this. The fact of the matter is the safety of the child is the main goal, and we need to see if this is a trend or if this is truly just an accident. And that way, the proper measures can be taken in order to be able to help this individual grow out of the situation and to live a peaceful life without abuse being inflicted. We're going to go over types of mental abuse. We have mental health, medical and educational neglect, spurning, terrorizing, isolating, exploiting, corrupting, denying emotional responsiveness. Here's a term: sticks and stones will break my bones, but words will never hurt me. But mental abuse is just as bad as physical abuse. The trauma that can be inflicted to the brain and that can cause these issues to the individual and can uh, develop trauma that will follow them the rest of their lives is definitely hindering on the self-esteem of a child. A child does not need to experience that kind of trauma. They need to be enforced positively, and nothing to hinder them mentally needs to be happening to them. A child in a developmental stage experiencing mental abuse is not ideal. It will hinder the rest of their lives, and they will experience short term and long term outcomes that they possibly might have never experienced if they weren't mentally abused or physically abused. Any type of abuse is not good for anybody, and as a result, we see these effects that happen to people. Here we have mental health treatment approaches. Uh, Different treatment is designed to address emotional and behavior symptoms and to enhance the healing of children and adolescents who have experienced sexual abuse. Engaging the children in treatment as well as families is important to the treatment process. Interventions are designed to not only reduce symptoms, but to also restore and encourage feelings of mastery and strength in survivors of sexual abuse. Here we go again with the point of providing the sense of comfort for the victim and to give them the motivation and the strength to restore what they lost at that point in time when they experienced the abuse. The well being of the child is the ultimate goal, and it is our responsibility to empower and to give this individual the ability to surpass these instances. And the first one I'm going to talk about is play therapy. This is one of the earliest treatments employed with children who experience sexual abuse. Play therapy is designed to reduce children's emotional distress through the symbolic communication of play. Play therapy is takes a corrective and reparative approach that allows the children to process the trauma in a manner that can be concisely understood and tolerated. Trauma like this can be very hard for a child to process and analyze, and play therapy really opens the door to be able to allow the communication of the trauma and to allow the disclosure of this issue and to allow the progress and to allow the child to grow and to not let something like that hinder their ability in life. Next one is cognitive behavioral therapy. Cognitive behavioral therapy is a psychosocial intervention that is most widely used evidence-based practice for improving mental health. CBT models are the most widely researched treatments for children who have been sexually abused. Caregivers in CBT treatment respond to greater decreases in self-blame and greater increases in caregiver support of the child. It's all about the betterment of the child. And I can't stress this enough. The therapy will only help the child if the caregivers are feeling as best as they can to support the child and to help the child victim really progress and to move forward from the trauma and to not let the trauma be a shadow that hinders the ability of the child to live a normal life. Ideally, therapy would work all the time. Sometimes it does, sometimes it doesn't. But we do have a good success rate on most of this. And the processing of this trauma is just essential when it comes to this. Then we have trauma focused cognitive behavioral therapy, which is evidence based psychotherapy or counseling that aims at addressing the needs of children and adults with post traumatic stress disorder and other difficulties related to traumatic life events. This treatment is intended to support their ability to manage the natural and unanticipated stressors of life they are likely to face in the future. This treatment has the strongest evidence of efficacy. This is another form of therapy that provides the support and the allowance of progression for the child to move forward from this traumatic experience. It's sad that they've experienced that, but the road to progression should not be hindered, and everything should be on a move forward basis. And in time, hopefully, the child can move forward from this, and the child can use the therapy that they learn to be able to help them cope with the pain that they feel inside. In conclusion, the prevention of abuse is essential, and the ultimate goal is the rehabilitation of the victim. When it comes to child abuse, we have a victim and we have a perpetrator. Uh, the perpetrator has something to gain out of the situation, and the victim has nothing to gain out of the situation. In child abuse scenarios, we are truly dealing with a victim that has been exposed to a traumatic event that they should not have been exposed to, and that the predator uh, and perpetrator exposed them to unwillingly. They didn't have a choice when it came to this. They didn't decide, oh, I'm going to be exposed to this kind of behavior. No, that's not what happened. The perpetrator forcefully exposed them to this type of behavior, which created this problem. And upon the creation of this problem, there needs to be a report to be known that this child is experiencing what they have experienced. And from the report, there needs to be an investigation. The investigation will allow the child to be able to find a window out of this situation, to be able to see a light at the end of the tunnel where they aren't hindered and they are really allowed an opportunity to progress and to grow into who they are supposed to become. The investigation aspect of this is always very tricky. Most of the time, the perpetrators aren't fully held accountable for what they did, but as long as the progression of the mental state of the child is there, and if the child is able to process the trauma through forms of therapy that can help them process and analyze and interpret the whole situation without the trauma lingering years later, that is the ultimate goal of this therapy. Also, having the support of the parents to give them that motivation, that standpoint, the love, the support. The children need that in this type of situation. They do not want to be in this alone, and they want to feel like people are understanding of their situation. When it comes to child abuse, children are afraid to say something and be rejected. Children fear retaliation from the perpetrator. Uh, the child at this point in time is truly a victim, and the child needs to be able to progress out of this dark place. And without our help and the help of professionals, the child may never be able to be normal again, uh, just because they were exposed to something that they not did not want. And the ultimate goal of treating child abuse is to give the child back the life that they had before it was taken away from them. Uh, Child abuse is very prevalent here in our state, and it's quite depressing. But I feel like if the awareness of this is made known, then we can actually move to a point where this changes and where things can actually start to progress. I really hope to start seeing this change, and I hope that one day uh, we can minimize this issue more and more. And I just want to thank you for your time, and I just really hope that we can move forward to a place where child abuse is minimal and, if anything, gone from this world. Um, it can be hopeful and progressive, and the well being of the child is the ultimate goal behind this.